So we're gonna talk about something especially interesting, having the sex talk with your kids. How exciting. So first of all, why should you talk to your kids? As a parent, you play a huge role in developing their sexual identity as well as informing them about their own sexual health. Their identities are more positive and stronger the better connection that you have with them. Have a good relationship with your kids and they have better outcomes coming out of it. They have greater identity determination, a better ability to delay sexual activity, and when they do decide to become sexually active, they tend to have a better ability to practice safer sex. So leaving it to other sources to tell your kids what's good, bad, and ugly doesn't guarantee for you that they're safe. Even when they're family members, grandparents tend to hold off on a lot of information that might be important. And when older siblings give information, it doesn't always end up the way that you want it to. Sometimes getting information from siblings, depending on what the older sibling tells the younger sibling's beliefs might become negative or positive. You never really know. When should you start talking to your kids? So like everything else, there is an appropriate time and there are inappropriate times. Appropriate times might be something that you would consider a teaching moment. And it's best if it already fits into the context of the conversation, or if you're already sensing that there's a question that might come up that's within the topic. So when exactly in their life should you start talking? The earlier the better. And you don't always have to start talking about intercourse itself or the big topics of LGBTQ, social issues, nothing like that. You can just start small. When I mentioned that kids are better off when they're spoken to when they're early, there's some adolescents that are able to reflect on that too. Adolescents reported that they wish their parents could have told them the information earlier in their childhood so that they could have exercised it currently. And for parents who did end up talking to their adolescents early, they said that the most effective way of communicating was with warmth and understanding. So besides the nitty-gritty, there is sexual orientation. So one of the first few things you might want to get your kid acquainted with is understanding LGBTQ, lesbian, gay, bisexual, queer, and trans. Try to emphasize respect around people. Explain to your child that a lot of people don't tell others that they are homosexual or gay, whatever you want to call it, because they're scared of what people might think of them. People will talk about who they're attracted to in their own time, and sometimes people don't realize it until they're far older. Try explaining to your child that people are the way they are. We don't really have an explanation for it. And as they get older, you can start bringing in genetic factors, environmental factors, as soon as they start understanding. One thing I would highly stress that your child understand is that you can't cure being gay. There's no cure, there's actually nothing wrong with it. With the emphasis on respecting other people, have them understand that joking around about being gay is not funny. So besides talking about who you're attracted to, you can also talk about what's going on downstairs. And you don't even have to use the word downstairs. As a matter of fact, don't be afraid to use the words penis and vagina. Those are natural parts of the body, and the earlier they understand that it's not so bad to talk about it, the more open they'll be with you. You need to know that curiosity is natural. A common action that kids might even partake in is touching themselves. Telling your child that touching their genitals is okay. It can make them feel good. Also emphasize that this should only be done when they're by themselves and when they're the ones doing it. As your child grows older into their preteen and teenage years, privacy is to be expected and respected. What matters is that you don't close your door. You need to keep your door open in case they have any questions about what's going on with them and their own experiences with sexual development. Talking about your own experiences might even help them out and giving them a sense of comfort. So we talked about who we're attracted to, what goes on with your body. Now we're gonna talk about who's allowed to touch your body. One of the biggest things that is just circling this entire part of this video is going to be that your body is your body and your body alone. If your child is very young, you can tell them that you have private parts that only you are allowed to touch. And if anyone else were to touch them, that's bad. And it doesn't even just stop at touch. It extends also to seeing different parts of your body. Abuse is a common occurrence. So it's important that when your child is told after they have been touched or abused to keep it a secret, before that could even happen, let them know you should never keep a secret. Never keep secrets about something that goes on your body, and always tell an adult. Stress to your child that when something is going on to their body by someone else to tell somebody about it. So why would we ever want to talk about sexual assault? It's all about safety, and it happens more frequently than we'd want to admit. There are many long-term effects of sexual assault and rape that would include extreme shame and guilt, especially if you're the victim, and a lot of those emotions extend from depression, anxiety, and can even result in PTSD. Let your children know that they are people and they should not be treated like objects. A term for this would be sexual objectification. That's when a person is viewing another person as an object that fulfills a sexual purpose. So these are a lot of heavy topics, so I'm gonna walk you through how to talk about them with your kids. A huge mistake that parents make is keeping the conversation to one conversation. A lot of parents avoid continuous conversation because they don't want to keep feeling uncomfortable with their child. And that uncomfortable feeling could spread to the parents not ever talking about anything sexual at all. When a parent remains silent, that silence is translated as negative affect in their children. That negative affect is salient also, or it can be, and it can spread out into their adulthood and just maintain that stigma that sex is just something we don't talk about. If you need a little help on how to act whenever you talk about sex, sexuality, and sexual topics with your child, just remember the big five. There's warmth, receptivity, composure, informality, and openness. So before you can give any information to your kids, you need to be informed yourself. It's gonna be weird looking things up on the internet and trying to find really good sources about what exactly you have to tell your children and how to tell it, but it's gonna help them in the long run. Also, do not try to dominate the conversation. When you're giving them only information and not pausing to make sure that they understand what you're saying, it gives little room for the children to stop and ask questions. Not pausing in between can also make the child feel like they're gonna be judged if they do ask questions. And like I said earlier, and I'm saying it multiple times for a reason, don't tell them everything at once. You want to be able to keep the conversation going. You want to be able to keep talking about it with them. Your kid isn't going to be 8 years old forever. Your kid is never not going to have any questions. They're going to have questions when they hit puberty, when they get in their first relationship. You want to know what's going on in their life to make sure they're safe. This might be a little bit hypocritical of me, but don't say don't statements. When you say don't do this, don't do that, don't do anything, it just makes them feel like they can't do anything at all. Be open. Be open to questions, be open to responses, and remember to check if they understand what you're saying. That's the only way you know that you're doing your job as a communicator. Children often don't bring up intimate conversations with their parents because they're worried of disappointing them. It's not a matter of whether or not they're going to disappoint you, and it's not a matter of whether or not you're going to be disappointed. What matters is that they get the information that they need to stay safe and to stay informed.
So I went over to the Texas Women's University Library and I found this. It's an awesome resource. It's called Who Has What. So what's covered in here is just basic male and female genitalia with also basic ideas of puberty. And it's simple enough for kids to understand. It's basic and clear, and although it doesn't have any censoring, it does give a very clear idea of what goes on downstairs. What I really like about this book is that it gives a clear sense of diversity also. It has very, although vague acknowledgments of whether or not you identify as a boy or a girl and how those things are different. This book is by Robbie H. Harris. It's wonderful. When your child does grow up and start experiencing more things and has more detailed questions, there's also this book. It's called It's Perfectly Normal, and it's all about changing bodies, growing up, actually experiencing puberty and becoming sexually interested in the opposite sex or the same sex. It's a little bit more detailed. There are plenty of more words to go over, and also a little bit more detailed drawings that hopefully they're old enough and more mature enough to understand all of that. This one is by Robbie H. Harris again, and it was actually illustrated by Michael Emberley. I'm guessing the go-to would be Robbie H. Harris. So thank you for watching. Anything else, if you want to look it up on your own, by all means, go for it. And don't be afraid to talk to your kids because it's going to help them too. Right, have a great day.